Okay? So please type 1 kung handa na po ulit kayo sa last part ng ating discussion. Please type 1. Okay. Yan. Nakagad yung iba, spell out 1. Okay. So now let's proceed discussing bronchiectasis. Okay. So ano bang definition ng bronchiectasis? Sundan natin yung second part ng definition. Meron siya abnormal and permanent dilation of bronchi or might be bronchioles with destruction of the bronchi walls. Guys, from the keyword ectasis, no, itong ectasis na to, yan, hinighlight ko ng red. Ectasis is a Greek word which means to dilate. No, dilate. Kapag may nakita kang dilation, bronchiectasis kagad yun. Okay? So yung type of bronchitis kasi might appear occur after childhood pneumonia or cystic fibrosis. Minsan, pwedeng ma-develop yung bronchiectasis due to childhood pneumonia or cystic fibrosis. So the resultant destruction of the bronchial dilation decreases bronchial wall movement so that secretion cannot be removed, no? Tapos effectively from lungs, and person or the patient is frequently predisposed to inflammatory infection. Usually guys, due to recurrent, no, pabalik-balik, recurrent pulmonary infections, nagdadilate ang airway. Ako ha? Next, what are the signs and symptoms? Meron siyang chronic wet cough with copious. Guys, copious to, no? So, meaning madami. Foully smelling secretion. So, malansa yung amoy, mabaho. Okay? Due to, recurrent pulmonary infection. So, may mga retained secretions. Next, meron din siya hemoptysis. Guys, what is hemoptysis? Paki-type nga yung sagot sa ating chat box. What is hemoptysis? Anyone? What is hemoptysis, guys? Ha? Ano sagot natin? Yes, coughing up of blood. Now, coughing up a certain volume of blood. Dapat may volume of blood, ha? Iba pa yung blood streaked or blood tinged. Yun naman sa hala ng dugo, yung plema mo. May konting dugo lang. Ito talaga, maraming dugo. No? So, that is a form of hemoptysis. Coughing up a blood or coughing up a certain volume of blood. Meron din sila occasional wheezing sound, kagaya ng asthma, may dyspnea din. Sometimes may sinusitis, no? Parang salita siya, parang alam mo, barado ng sipon yung ilong niya, no? Then decreased weight, pumapet din sila, may anemia, walang gana sa pagkain. Malaise, may general body weakness, no? Nakihina. Next, may recurrent fever and chills. So nilalagnat. So sa karamihan ng COPD, siya po yung may hemoptysis, meron ding fever. Bakit may fever? Kasi nga, pabalik-balik yung pulmonary infection. And of course, meron ding fatigue. Yung tatandaan nyo lang dito, siya lang ang tanging COPD na may hemoptysis, saka may fever. Okay? So what are some of the treatment, no, for patient with bronchiectasis? Postural drainage to drink secretions, adequate hydration and good nutrition para lumambot yung plema. And of course, prone nga sila, di ba, sa anemia. So magkakaroon sila ng weight loss niyan, papayat. So kailangan ng good nutrition. Bronchodilator therapy kasi initially, there would be bronchoconstriction, accumulation ng mga thick secretions, yun yung nagpapadilate ng airway. Okay, nakuha? Kailangan din bronchodilator drugs or therapy, including antibiotics, kasi sometimes this could also lead to pneumonia, no? Mga bacterial pneumonia. Okay? Guys, may nagtanong sa akin dati, sir, bakit may hemoptysis? Itong si bronchiectasis. Kasi ganito yan. Di ba mayroon ding blood vessels? May mga malilit din blood vessels attached to your airway, inside the airway. Once na mag-dilate, na bumuka na yung airway, yung mga malilit na blood vessels na overstretch. So pumuputok sila, nagra-rupture. So the blood escapes from the small blood vessels and then sasama sila sa plema. That's why may hemoptysis. Yun ang explanation doon. Due to dilation of the airway, yung maliliit na blood vessel na nakatouch sa inside ng airway mo, na overstretch, na rupture, nasira. So automatic yun yung blood, sasama doon. Nalalabas yung from the small blood vessels, sasama sa plema mo. Kaya that's why mayroong hemoptysis, si bronchiectasis. At siya lang ang may hemoptysis. Okay? So guys, ito yung picture ng may bronchiectasis. So dilated ang airways, may mucus secretions, no? And then once na ma-overstretch, mag-dilate yung airways, masisira yung maliit na blood vessels, kaya mayroon din blood sa sputum. Okay? So ito po yung picture or chest x-ray picture ng person with bronchiectasis. Okay? And the last COPD would be what? Your cystic fibrosis. Si cystic fibrosis, guys, meron pa po siyang other name. Anong other name niya? It is also known as mucoviscidosis. Ano daw other name? Also known as the mucoviscidosis. So most common daw siya na lethal genetic disorder affecting whites. So meaning namamana siya. Commonly seen sa mga Caucasian, sa mga whites. there is widespread abnormalities in all exocrine glands. And there will be increased secretion leading to obstruction of the airways. Guys, pag may problema ka with exocrine glands, lilitaw itong tatlo. There would be affectation ng pancreas. Particularly, guys, yung exocrine cells. No? Exocrine cells of pancreas. Ano pa? Sweat glands. Siya yung nagre-release ng pawis. Mucous glands, nagre-release ng mucus. So, itong tatlong ito are the affected exocrine glands. Pancreas, sweat glands, including mucous glands. Sa ibang libro, itong tatlong ito, tinawag din silang triad of cystic fibrosis. No? The triad of cystic fibrosis. Next, bakit ba nagkaroon ng abnormalities sa exocrine glands ni patient? Kasi may affectation of specifically the long arm of chromosome 7. No? May abnormality, no? Sa chromosome 7, specifically, its long arm. Kasi each chromosome, guys, may long arm, may short arm. Ang affected lang dito kay cystic fibrosis would be the long arm of chromosome 7. Eh ano bang tulong? Ano ba ang purpose nitong long arm of chromosome 7? Siya lang naman ang kumukumpleto sa development ng exocrine glands. No? For the full development of exocrine glands. Eh kung may depekto itong long arm of chromosome 7, eh di lilitaw yung problema mo sa exocrine glands. Affected ang pancreas, ang sweat glands, including the mucous glands. Ganun yung explanation. Okay? So ano yung mga makikita mo sa patient? Sometimes, patient might present with increased sodium chloride. Parang asin, di ba? Sodium chloride is asin eh. Content in sweat. Okay? Kasi affected na ka sweat glands. Normal naman talaga may konting sodium chloride, no? Or asin sa ating pawis. Kaya maalat ang pawis natin. Okay? Pero sa patient with cystic fibrosis, increase yung sodium chloride content in his sweat, no? Patient's sweat. Okay? Okay. O guys, ano-ano yung hallmark and sign symptoms? Hallmark niya, chronic coughing and production of copious, marami rin amount of thick, purulent mucus or secretions. Ano yung mga early sign symptoms? Might be may tachypnea or bradypnea. Alin man dito? Tachy, increased respiratory rate. Brady, decrease naman. May coughing din siya, may wheezing din, kagaya ng ibang COPD conditions. Barrett-chested, kagaya ng emphysema din, no? Lethargic, meaning low energy. Anorexic, walang gana sa pagkain, no? Cyanotic, same with chronic bronchitis. Meron din silang bluish discoloration. And of course, meron na rin hypoxemia, decreased oxygen in the patient's blood. So ito yung mga common signs and symptoms naman with cystic fibrosis. So what could be the X-ray finding, no, sa patient with this kind of condition? Guys, ito yung mostly makikita nyo, may presence siya of what we call honeycomb lungs. Ano tawag? Honeycomb lungs. So later pakita yung picture ng honeycomb. Usually ang mga pasyente may cystic fibrosis, mga bata, children. They're affected yung kanilang chromosomes kasi sa genes yung problema, no? So nakalagay dyan cystic fibrosis, hereditary disorder, characterized by lung congestion and infection. Tapos may malabsorption. Most of them, guys, pumapayat. Nagkakaroon din sila ng weight loss, kagaya ng emphysemic. But the reason of weight loss, kasi di ba may problema din siya saan? Sa kanyang pancreas. Ito, yung unang affected na is yung pancreas. We know that the pancreas is the one that secretes pancreatic juices. Okay, nagsisecrete si pancreas ng pancreatic juices. Anong ginagawa ng pancreatic juices? Siya lang naman ang tumutunaw ng foods na hindi kayang tunawin inside the stomach. Alam niyo ba guys, trivia, no? Trivia lang. Hindi lahat ng foods dinadigest sa stomach. Yung iba, sa small intestine. Particularly sa first part of the small intestine known as the duodenum. No? Duodenum. Guys, yung fats, cholesterol, and other proteins, ano itong binanggit kong tatlo? Fats, cholesterol, and other proteins, hindi sila kayang i-digest inside the stomach. Saan sila dinadigest? Kay duodenum, sa unang part ng small intestine. Kasi may nakatas doon na pancreatic duct, galing kay pancreas, at meron ding gallbladder duct, galing kay gallbladder. We know that the liver and the gallbladder, si liver, taga-produce ng bile, ng green pigment, no? Ang mag-store ng bile, si gallbladder. So, magre-release lang siya ng bile pag may dumaan na fats, cholesterol, protein sa duodenum. Ganon din si pancreas. Magsisecrete lamang siya ng pancreatic juices pag may dumaan na fats, cholesterol, protein din sa duodenum ni small intestine. So, sabay yun. Bile, galing kay liver, gawa ni liver, in-store ni gallbladder, tapos pancreatic juices galing kay pancreas. Sabay yun, parang ina-ambush. Sinong food? Si fats, cholesterol, protein, para matunaw. Eh, since may problem ka with pancreas, di kulang, insufficient, yung sinusupply niya pancreatic juices. Si bile lang ang tumutunaw. Tingin mo, madadigest siya into smaller molecules, into nutrients? Hindi. Hindi madadigest yung tatlong yun. Yung fats, cholesterol, protein into smaller molecules. Hindi siya ma-absorb sa middle portion ng ating small intestine, di tatapon lang. So pag tinapon siya, hindi ma-absorb yung nutrients, papayat yung pasyente. Kaya nga may weight loss. No? Pumapayat sila. Nakalagay dyan, no? May malabsorption of nutrients, kaya meron din silang weight loss. Then, ito yung sinasabi kong picture ng honeycomb lungs. Parang alam niyo yun sa Squid Game, yung honeycomb biscuit or cookie. Yung may figure doon, kung napanood niyo yung episode mo. Yung kailangan, may figure doon, matanggal yun doon sa buong cookie. No? Honeycomb cookie. Yung figure na tatanggalin para mabuhay pa sila. So parang ganyan yung picture din ng honeycomb lungs. This could be seen in patient with cystic fibrosis. Okay, so guys, maliwanag po ba? So ito naman yung x-ray, no? Ng person with cystic fibrosis. Okay, klaro po ba guys? Klaro? Please type clear kung naging klaro tayo sa ating discussion. Please type klaro. Clear or klaro. Yan. Okay, yung iba po. Ayan, okay. Guys, last set of drills po tayo, no? Before we end our session for today, no? So, guys, isasama na natin yung tatlo, no? Kanina meron na tayong emphysema, chronic bronchitis, tapos idagdag natin sa drills natin yung asthma, bronchiectasis, and cystic fibrosis, no? So, for emphysema, ang isasagot nyo lang letter E. For chronic bronchitis, initials lang, CB chronic bronchitis. Pag asthma, letter A lang. Pag bronchiectasis, letter B lang, no? Initial lang na letter B. Pag naman cystic fibrosis, CF. Initials lang, CF, cystic fibrosis. Okay? So, handa na po ba kayo sa ating drills? Please type ready kung handa na sa ating drills. Please type ready. Okay po. Okay, so sagot po tayo ha. So, first question. It is also known as pink puffer. Also known as pink puffer. Yes, it's your emphysema. Next, also known as mucoviscidosis. Also known as mucoviscidosis. Yes, it's your cystic fibrosis, no? It's your cystic fibrosis. Also known as blue bloater. Also known as blue bloater. Yes, your chronic bronchitis. Chronic bronchitis. Guys, ang age daw po niya, 50% of them are less than 10 years old. 50% of them less than 10 years old. Boys commonly affected than girls. Yes, it's your asthma, no? It is your what? Asthma. Okay ba ako sa kabilang room? Room 1 ba to? Ayan, okay. Lumabas na yung answer. So, asthma, no? Next, sino naman yung may age na more or less 50? More or less 50 years old. Yes, it's your chronic bronchitis, no? Chronic bronchitis. Next, sino naman yung more or less 60 years old? More or less 60 years old. Sure what? Yes, the emphysema, no? It's the emphysema. Next, sino nga ulit yung may permanent dilation of bronchi or bronchioles? Permanent dilation of bronchi, bronchioles? Yes, it's your bronchiectasis, no? It's the bronchi or bronchiectasis. By the way, nakalimutan kong banggitin. Lumabas pala to that sa board exam. Ano yung commonly affected na airways kay bronchiectasis? No? Most commonly affected airways kay bronchiectasis. Pakidagdag nyo lang dyan sa note niyo. It's the terminal bronchioles. No? Pag bronchiectasis, commonly affected na airways, terminal bronchioles. Yung last portion ng conducting zone. No? Terminal bronchioles. Next guys, sino po yung merong widespread abnormalities of exocrine glands? No? May abnormalities of exocrine glands. Yes, it's your cystic fibrosis, no? Cystic fibrosis. Sino nga ulit yung may chronic productive cough of at least 3 months for 2 consecutive years? What is this? Yes, it's your chronic bronchitis, no? Chronic bronchitis. Sino naman ito? Has hypersensitivity of bronchial smooth muscles due to various stimuli resulting to widespread bronchoconstriction. Yes, it's your asthma, no? This is your asthma. Next, sino naman yung may overdistension of air spaces? Overdistension of air spaces distal to the terminal bronchioles with destruction of the alveolar septa or alveolar walls. Yes, it's your emphysema, no? Emphysema. Next, sino po yung may affectation ng pancreas, ng sweat glands, and mucus glands? Yes, it's your cystic fibrosis. No? The cystic fibrosis. Sino naman guys yung meron thick stringy mucus known as the Kirschmann spirals? Meron siyang Kirschmann spirals as the thick string mucus. Yes, it's your asthma. No? The answer is asthma. Ang sputum niya is scanty and mucoid. Scanty and mucoid. Yes, it's your emphysema. Eh pag ang sputum niya, copious and purulent. Copious, madami, purulent, may nana. Yes, it's your chronic bronchitis. No? The answer is chronic bronchitis. Okay, saglit guys, so medyo nag-hang. Mag-out lang ulit ako, balik ko. Medyo nag-hang.